video is just going to explain a little bit more about pain and how your body and your brain deals with it. Alright? So what you got to understand when it comes towards pain and the brain's got two decisions to make in order if it's going to give an output, which is pain. So it's going to tell you whether it's safe or whether it's not safe. If it's safe, you have no pain. If it's not safe, then it will give pain. Now what determines whether it's going to be safe is, number one, it's going to be the injury, but once you go past the normal healing phases of injury, then there's other factors that come into play, like your previous learning history. If you've injured that joint before, if you've heard like kind of horror stories where people have had back pain for years over some minor little cause, all of these little things will tick off in your brain, and then what the output will be is being an emotional response. You'll start to get anxious towards it. Okay, so initially what you'll have is you'll have an injury, the pain will increase, and then what will happen is you'll start to compensate. So much like when you injure an ankle, you develop a limp to try and avoid the pain, and this becomes normal for you. So what happens is you compensate it. Now what your compensation does is it tells the brain it's not safe. So when it says it's not safe, pain is going to increase. You continue to limp on that leg and avoid using it. It's going to reinforce this pattern that, number one, it's not a pattern of movement, but it also reinforces and telling the brain that it's not safe. So your pain. So this big circle keeps on happening. Now what happens is, and what physios can kind of work on, and what we tend to work on in the clinic, is this. Let's have a think about what the brain is doing and how we're going to influence that. So if you're compensating, yes, what we can do is we can treat that. All right. And how do we treat that? So when you come in and you compensate, and there's going to be a couple of different factors that's going to be involved in it. You're going to have increased muscle tone in there. You're going to avoid using that leg. And we use certain techniques like just standing on one leg just to see how long you can hold that for. You'll probably feel one leg is weaker than the other. So then we go, okay, so it's the left leg. So let's test the knee a little bit more. We can do different tests for that to see if that's going to be weak, or is it the hip, or is it the ankle. So in other words, when you have that pain, protective muscle tone is going to increase. Now what do we do to help that? We can kind of massage it out, we can do some deep tissue release, we can do some dry needling, we can use some shockwave therapy to all help that nervous system, help it to make it feel safe. Alright. Then what we do is when we get it to feel safe and you kind of do the massage and you kind of feel all that better, then you kind of, alright, hold on, this isn't too bad, actually this feels an awful lot better. So then what we go to do is we start to load the tissue. So we start to put some strength through it. So we start to do like reps of exercises that are going to strengthen that. You're going to feel quite difficult, but the whole idea is not to make you work out. The whole idea is that, hold on a second, to tell the brain you can move into these positions and you don't have pain after I do the release. So it's not the massage. Technically it is the massage that kind of gives you a little bit of a release, but what it's doing, it's dampening down what we call your sympathetic nervous system. Now this is a nervous system that is increased in times of stress. So when you're in pain, or years ago when you were getting chased by a tiger and about to be eaten, and what happens with the nervous system these days is it's going to be increased due to anxiety, financial worry, emotional problems, lack of sleep. All of these things is going to increase that. So what we do with the massage is help to release and try to dampen down that nervous system. So when we dampen down the nervous system, as I said, we load the tissue. When we load the tissue, you start to feel a little bit more confident in it. And what happens is your pain starts to reduce. Now what we do is when you reduce the confidence in it, is we make the brain start to feel very, very safe. So what we're doing is we're moving out of this compensation phase and then back into it. Now this, depending on how long your pain is going on, this is going to take a little bit of time. So what will happen is that you come in, you do the exercise, you feel great, a couple of hours later you get that little twinge, and then that self-doubt starts to kick back in. Oh, maybe this is not as good as what I thought it would be. And what will happen is you'll go back into that compensation phase. So for an ankle injury, you'll go back in to start to limp it and try to protect it, which again tells you it's not safe. So what happens is the pain is going to increase. Okay, so what we do is we do this a couple of times. We kind of keep on reinforcing and telling the brain that it's safe, it's okay to move. A certain level of pain is acceptable, but for some instance, for somebody who's never been injured, they've never experienced pain before, so they're very, very cautious of it. So what will happen is then we constantly get them to do the exercises. Just nice little gentle ones, just constantly reinforcing that brain, tell them it's going to be safe, tell them to reduce down the pain levels, everything's going to be okay. And then once we kind of get to an acceptable level of kind of, right, we can do these movements, we gradually start to load these tissues. And this is where 90% of the people start to fall down. So what will happen in these instances, they'll go back into the gym, they'll slap on 80% of the weight of what they've done before, and they'll start to lift. And what will happen is the pain will come back. The reason the pain comes back is because those neural pathways that they've been using, that normal muscle firing pattern is going to be changed because it's been compensating for so long, whether it be your back, your hip, your knee, or your ankle, or even your shoulder. So what happens is you overload those tissues, and then you go back into that compensation pattern. You feel that it's not right, the pain is still sore, or the joint is still sore, the pain is still there, so I'm not healed. And then that'll go around in a vicious circle. So the idea behind it is to gradually load the tissues as much as we can. A certain amount of pain is acceptable, that's absolutely fine. Generally the rule of thumb is if you get anything over a 4 out of 10, then you're probably going a little bit too much over, but a little bit of pain is going to be acceptable for it. So as I said, this is what the physio does, this is what we do in the clinic. We try to educate people as much in the content to let them understand their pain as much as they can, and that it's not always going to be related to tissue injury. Simple analogy I use: if you squeeze your ear as hard as you can, you're going to have pain in it. You take your hand away, there's no pain. Is there any damage? No, because it's just an alarm system to tell you if something is wrong. In certain instances, alright, you are going to have damage. In certain instances, you can have a look at your MRI, and yeah, you're going to have a little bit of stuff that's going on in it, like degeneration or a disc bulge or something like that, but that's actually completely normal. What we're starting to believe now is that it's actually just a case of aging, that those structural abnormalities start to show up on your MRI. Same way as you're getting wrinkles or you're getting grey hair. It just happens as you get older. It's nothing to really be worried about. What we're more concerned about is that what is driving your pain. Is it the fact that you're compensating, you're weaker on one side than you are on the other side? And 9 times out of 10 it is going to be down to a weakness. It's going to be a weakness somewhere that we'll have to strengthen up, and if we strengthen that up, then indirectly we're telling the brain that it's safe and you're okay to move. And that's why we kind of get a lot of successful treatments in here. We explain it a little bit more, give it a little bit of spin, a little different spin on other people, rather than going in for a massage or you have to stop doing this. We never stop people going into the gym. If you injure your ankle, you can train your upper limb. If you injure your foot, you can still train your upper limb. If you injure your upper limb, you can still run. So we keep people moving as much as they can. So that's it, guys. Any questions, just drop me a line. Hope that makes sense.